The body of a woman who went missing at Flamingo in Accra along with a one-year-old son during Sunday evening's downpour has been recovered. The search is however continuing for the baby who was strapped on the back of his mother. It brings to 4 the number of confirmed deaths in Sunday's floods. Maxwell Agbagba was with the NADMO search party and our reports.
Yeah, when we are coming, we have this guy. We have also asked him right now.
Volunteers from communities around the Kole Lagoon were on hand to assist the NADMO search party. The team is made up of some personnel of the National Disaster Management Organization and family members of some persons unaccounted for after the rain. This confluence is an entry point for some of Accra's major drains. The search party believes that the missing woman and her baby could be found here. They are keeping hope alive that they'll be found alive, healed and hearty. Naomi Agbabu, with her son on her back, is said to have been forced out of her home when the flood waters began to rise.
She first sat in the car but stepped out after the water entered it. People were up there watching her. They told her the place was dangerous. Some seconds later, they heard a big splash in the water. The people then started to raise alarm. Her husband jumped into the water in an attempt to save her, but for the intervention of some men, he would have also died. He sustained some injuries and was mentally unstable. He was taken to the community hospital at Sukura. Before the rains in the afternoon, the little boy opened the door and was yelling my mother's name. And my mother responded, "Agbagbu, are you in the room? I can't lift you. If I do, we'll both fall to the ground."
The Kole Lagoon is reflective of Accra's plastic woes. Just some hours of rain, and what you see here is not flowing water. No, it is flowing plastic. Some of them stuck in the silt here in this lagoon. The Greater Accra Regional Coordinator of NADMO, Archibald Kobana, believes this is part of the problem of perennial flooding here in Accra.
You should not stand by and let somebody else be dumping. And we are fond of doing that, especially when the rains begin. Because when the rains begin, you find that the streets are quite quiet. Everybody's running, trying to take shelter. And so people find it easy to take garbage and waste from their home, trees that they've cut, waste that they've gathered, metal objects and all of that, and come and dump them into the drains.
The body of the woman was eventually found behind a hotel along the Kolegon coastline by some fishermen who then alerted the Kolebu police. According to NADMO, the body has since been deposited at the Kolebu Teaching Hospital morgue. Some parts of Dansoman and its environs were also flooded after Sunday's rains. I've been speaking to the MC of the Ablekuma West Municipal Assembly. He is blaming choked gutters and some areas he describes as low-lying.
Unfortunately, it is to be expected because there is a greater part of the municipality that is very low-lying. And unfortunately, it is not habitable. But it so happens that a lot of settlements have sprung up in the area over the last couple of years. So whenever it rains, you get some of these homes getting flooded.
All right, so we keep on getting all these headlines about people dying each time we have floods in this country, and we're going to be taking you through some of the headlines. So we have this headline, December 2014 or June 2014, middle-aged woman found dead in Accra's torrential rains. And then people sent home, shops closed, 200 die in Ghana's historic floods. And this, of course, had to do with the June 2015 floods that hit Circle. NADMO retrieves 2 bodies after Monday's floods, 4 persons missing. plastic waste crisis partly contributed to June 3 disaster. That's according to a report. And then search parties find body of missing doctor. All right, so we keep on getting all these headlines, and one keeps wondering at what point is it going to stop and who should be held culpable. We're joined on the line by Professor Etuahini, who's going to be taking us through some of these concerns that have come up. Good evening to you, Prof. Now, we have seen these headlines, and we keep on hearing headlines and deaths announced each time there are floods. It appears it's never going to stop, but is there a way we can hold somebody or some entity culpable or accountable for these deaths? It turns out we have lost the professor there, but we'll try and reestablish that connection to him. But the Ghana Meteorological Agency has also been speaking about this, and they're warning that there's likely to be more rain.
We have just begun the rainy season over the southern sector of the country. So the coastal areas, that's Greater Accra, the lower portions of Volta region, would be experiencing more frequent rains from this April. And the rain will also be accompanied by very strong winds, that's convective type. It will be turbulent during rains, very cloudy, and mostly they will occur in the afternoon and continue into the night.
Okay.
There will be thunderstorms and lightning strikes that will accompany these rains because of the high temperatures that we are experiencing at this time. And lightning is quite dangerous, so we have to prevent.
All right, we're going back on the phone lines now to speak with Professor Kojo Etua. He's a law lecturer at the University of Ghana. Thank you very much once again, Professor Etua, for joining us, for speaking with us. Now, we have heard these headlines. These headlines keep coming up all the time each year. The people die from these floods. It turns out that they're never going to stop. As we're having another death, we're recording another death this time round, 4. Now, the question I'm asking is it possible that we could hold somebody culpable or accountable? And is that going to stop?
Hello, thanks for having me. Yes, I think it is possible to hold somebody responsible. Here we are looking at the fact that when we are talking about human rights, we have the duty bearers and then the rights holders. For every right to be meaningful or to be enjoyable, somebody has to bear the responsibility of doing something or not doing something. And if you look at it in a larger context, the state is the primary duty bearer of to enable the citizenry to enjoy their rights. And so if you look at the perennial flooding and the fact that every year it leads to loss of life, there are human rights implications. The right to life is one of them, 2 people dying. The right to work is even affected. The right to shelter is also affected. And generally the right to health, because cholera and other health issues come in there. So if it happens on a regular basis, and we don't see any action on the part of government, then one of the duties on the government, which is the duty to fulfill, the duty to provide certain amenities for the people, is being broken. And that duty relates to what we call economic, social, and cultural rights. So in that respect, the government can be held responsible for some of these consequences of the perennial flooding which comes every year. And it is due to the fact that the basis for making that claim that government could be held responsible is due to the fact that every year the government itself admits or says directly or indirectly that it is doing something about the problem. But every year, nothing is done. This year, this evening, the news is reported that money that are supposed to be released to do the dredging and so on has not been forthcoming. And so you can trace that to the doorstep of a particular ministry, and therefore the government can be held responsible for that.
All right, Prof, you indicated that government could be held responsible for some of the fatalities that occur, or the accidents that occur, but can government be held accountable for all of them? And how do you establish culpability on the part of government?
Well, the culpability lies in a number of respects. For example, when the June 3 disaster happened, there was a committee set up or a commission set up. They came up with recommendations, one of which was to set up a sanitary police, as far as I can remember. Nothing of that sort has been done or has happened. And so that we trace that to the government not fulfilling its responsibilities towards the people. There are supposed to be laws regulating where you construct buildings and so on. That is not respected, which is also responsible for the flooding happening. So these all can be traced to the doorstep of the government. But of course, it is not with respect to every situation that the government can be blamed for. So in that respect, you cannot say that 100% the government should be held responsible. But in general, that is the conclusion you can come to. And in the majority of cases, you can make a strong case that the government should be held responsible. So much as it should be done on a case-by-case basis, the premise is laid down clear that government, by not following the recommendations of several commissions of inquiry and so on, set up to deal with such problems, that in itself is an acceptance of responsibility.
Now, Professor Tia, who can sue?
There's something we call public interest litigation, whereby anybody can sue, but that person should be able to have a few victims being joined to the suit, or suing on behalf of these victims, whether direct victims or indirect victims. And so that is how it can be, the process can be initiated and undertaken.
All right, thank you very much, Professor Kwejo Etia. He's a law lecturer at the University of Ghana. Thank you very much for your time. Now, a 35-year-old Nigerian, Rebecca Ojo Odonsi, has been sentenced to 6 years in prison for lashing her daughter's palm with a kitchen knife and a pair of scissors. The 12-year-old, according to her mother, has been stealing from her to give to her boyfriend. Rebecca Odonsi, who was convicted on her own plea, told JoyNews she was driven by rage after her daughter ignored her numerous warnings. She's been speaking with my colleague Patricia Roxing-Hammond.
Rebecca's trial has been swift. She was arrested last Friday. Her trial opened on Monday and was convicted same day after she pleaded guilty. Though a tearful Rebecca admission inflicted the wounds on her daughter, she explained she had come to her wits' end after several efforts to talk her out of it.
The trouble my daughter had been causing me, she had always been stealing anything, unless she didn't set her eyes on the thing. If it's money, any amount it is, she will take all. She will not leave anyone for me. Reaching last month, it was 2 phones she stole from the house. Somebody plugged phone in my room. She stole it and gave it to a certain boy. They call him Charles. My own phone, I was also sleeping. She take my own phone to the same Charles. I took her to Super Police Station to report the case. They said that it's the child. They cannot discipline her. They cannot do what I asked them, because I asked them to detain her and investigate who had been sending her to steal. They said they cannot do that. I returned her home. So I now decided to return them back to Nigeria. I called the father for him to send me money so that I would send them back home. He told me ending of the month, the 9th, we sleep again. 119, the 50 pesos that left in my purse, she come in and take all without leaving even 10%. And that was the last money that left with me that I was having. So when I wake up and realize that she had taken the money and she left the door open and lie down again, pretend as if nothing happened. That money she took that night was the last money. When I think, what are we going to eat tomorrow? I was so frustrated because I don't know who to go to. I don't know who to run to. The father promised to send money. He have not sent it. That was the only money that left with me, even in the bank. I used the scissors to cane her hand. I used the knife to cane her hand. I didn't use it to cut her. I was caning her with the thing because if she do something, you don't do her anything. The next day, she will do the bigger one. She will do the one. She don't want to change. She started this attitude from Nigeria before we left the country to Ghana here.
The victim, together with her 2 siblings, have been taken away from Rebecca to Nigeria, and she is also expected to be deported after she serves her sentence. She's, however, pleading to be pardoned so she could fend for her children.
I have to go and take care of my kids. If it's to send me back to my country, I will go back to my country, not to send me to jail because nobody will take care of the other 2.
Deputy Regional Coordinator at DOFSU, DSP Cecilia Harriet Apia Ampofo tells JoyNews fast-track sentencing is how the units will now be handling abuse cases.
Every child has the right to live and right to do everything. And you don't discipline your child to hurt him or her. It's against Ghana's law. The acts, the Constitution doesn't allow that. And DOFSU, our acts also doesn't allow it. If a child does something, you have to correct him or her in a rightful way. You don't correct him or her as in punishing him or her. Any woman who assaults her son or daughter or her child will be arrested and sent to court, and she will be prosecuted.
Rebecca is expected to start her sentence on Tuesday. For JoyNews, Patricia Roxanne Hammond, Accra.
Elsewhere, a baby born less than a week ago at Nadoli in the Upper West region may not survive much longer unless his parents can mobilize the 12,000 cedis he needs for an emergency operation. He has been diagnosed with hydrocephalus and spinal bifida even before he is old enough to be named. His parents, who are subsistence farmers, say though they have looked forward to the birth of their son, they don't have the means to pay for the surgery. JoyNews' Upper West Region correspondent Rafiq Salam visited the neonatal ward of the Nadoli Hospital and reports his situation continues to deteriorate with each passing day.
His delivery was especially challenging because of the size of his head. Doctors therefore had to perform a cesarean on the mother. That was when he was found to have the defects. Nurses at the Nadoli Hospital, where he was born, named the boy Baby Agnes after the mother, Agnes Lebalanye. Dr. Matilda Asayoro, one of the doctors who delivered baby Agnes, explains his condition.
Hydrocephalus is simply an accumulation of fluid, cerebrospinal fluid, in cavities that are deep down in the brain, called ventricles, resulting in enlargement of these ventricles and hence enlargement of the head. That is why this baby has a big head. There are other problems that can be associated with myelomeningocele or spinal bifidus, among which are paralysis of the legs. This baby, in fact, has paralysis of his legs. There's no power in the lower limbs, and also there's loss of sensation in the legs.
Acting medical superintendent of the Nadolo Hospital, Dr. Ibrahim Donko Muslim, stated that the condition, though strange, can be treated if given the appropriate and much needed care.
And the good information is that it can be treated, but it can only be treated at a certain cost that is not available to this poor woman. So our cry is that can we come together and then mobilize resources to treat this child's condition? Because once this condition is treated, then the child has a good, survival, potential, and then can grow to achieve his full life potential. So we are calling for treatment, and then the support to help this treatment become a success.
The cost of treating the hydrocephalus and spinal bifida is pegged at around 12,000 Ghana cedis, way beyond what middle-aged Agnes and the husband can afford. She, like her husband, are subsistence farmers at Damba in the Nodolo-Keleo district, who are barely able to provide 3 square meals a day for the upkeep of the family. Mama Agnes is restless at night because her baby cries all night.
Because of the big sore at his back, he is unable to lie supine. It worries me a lot. The money needed to remove it is too huge, and we can't afford it.
Nadolo-Keleo District Director of Health, Phoebe Balagunyantimi, has already started a campaign to ensure baby Agnes survives.
We tried getting the neurosurgeons and to find out if we could send a child. I sent the pictures, and they gave us the assurance that something can be done. But the question was, how will they go? Because when we decided to write the referral, the family actually resisted. They told us that there was no way they could move from Nadoli to any place because they didn't have money. And they insisted they wanted to send the child home to do local treatment. And looking at this child, as soon as the child gets home, what we call infection is enough to even kill the child. Again, going to take herbs and concoctions and whatever they intend doing was just a panacea for what? Pushing this child early to his grave. And for me, I think that we can never tell what this child will grow up to be. And we as a team here are not presiding over what? Dead bodies. We want to preside over living beings.
Madam Phoebe is appealing to government, benevolent organizations, and individuals to come to the aid of the family.
I'm looking at other conditions and discussions with some of the neurosurgeons. They're talking about close to 12,000 Ghana cedis. Close to 12,000, yes. But of course, I know the mother will also need something into the packet. You are moving out of your own environment into another environment, and talking about feeding and other things, it's something that we need to.
Reporting for JoyNews, Rafiq Salam, Nadoli.
The minority in Parliament is urging government to abandon its plans to introduce a fresh law to govern all public universities. Minority spokesperson on education Peter Nochu says the legislation is an attempt by government to control public universities, which will result in chaos on the campuses. He says the minority will oppose the legislation when it gets to the House.
This current bill that is being proposed to come before Parliament is an attempt to curtail the autonomy or the independence of these public universities. Government is trying to usurp the powers of the governing authorities of the university by making sure that most of the decisions that will be taken at the university, government will have an overwhelming influence on these decisions, such that the universities will be run as if they are basic or second cycle institutions. So every directive will now be coming from government, which is not good for academic freedom. We're going to have an overwhelming majority and determine who should run the university. Maybe the appointment of the vice chancellor, the pro-vice chancellor, the deans and principals of colleges. That is what government is attempting to do, so that they will control the appointment of people who should serve as officials of the university.
And envisage this could be chaotic?
Yeah, it will be, because if government does not take care, what is going to happen is that those who even don't qualify for that position will be favored for political reasons over people who qualify to run those institutions.
So this new legislation, if it's introduced, will you support it?
If it is in the current form that I hear and have since one or two things, then I will not support it, and I hope my minority will not support it.
And what changes would you want to see before you may allow it to pass? Or your suggestion is they abandon the idea completely?
Yeah, my suggestion is that we should think of how best we can encourage the universities with the limited resources that we give them to improve on the administration and organization of the universities, rather than taking that autonomy from them and making life or academic freedom taken away from them. Yeah.
NPP MP for Ayawaso West Wugong, Lydia Sarah Malasa, is calling for increased efforts to ensure universal access to health for all. In a maiden statement on the floor of the House, she called for the support of international partners and local health institutions to make this possible. She tells JoyNews health delivery in rural Ghana needs to be prioritized.
There are about 6,000 CHIP compounds in the country. What we need to do is to equip them, is to add more machineries, personnel, so that even the rural areas and all become attractive to our health workers to work in. We should also look at collaborating more with our donor partners. Currently, Ministry of Health is in collaboration with World Bank, Ghana Health Service, and the Ghana National Insurance Authority to come up with a package where the vulnerable, the underprivileged will be taken care of with or without financial wherewithal. This and many others is what we are doing to achieve the BHC. I keep talking about the rural areas because I think that is where we have a bit of a challenge. So we should give incentive, more incentive, or we should motivate health workers who are in the rural areas. We should take good care of them to us.
Government is urging doctors to exercise restraint over threats of possible industrial unrest over their non-basic salary allowances. The Ghana Medical Association, in a statement last week, questioned government's commitment to implementing an agreement reached in October last year to ensure better conditions for them. The doctors say government's promise to implement the agreement and pay the monies in March has not materialized. Deputy Minister for Employment and Labour Relations, Bright Reku Brobe, says the monies will be paid by next month.
We plead with the Ghana Medical Association to, as it were, continue to exercise restraint and give government a different look by way of commitment to some of these agreements we do with them. It's a human institution. We promise we will do this, but then certain constraints would set in. Indeed, we have an agreement with them to ensure payments of some of these monies from April. I must indicate that as at Friday, a lot of work had been done, and then an instruction written from Ministry of Finance to Controller to ensure that in April we pay them the 2 months which we said we would do, and subsequent payments as well. So I would urge them to exercise restraint. Controller tells us that they needed the instruction by a certain date and timelines. We should be seen to be doing our part of the bargain. So we must not worry. The public must not worry as to whether there will be industrial action. We should all wait and see when the money is paid, then the commitment becomes 100%. As we speak now, you may say it is not 100% because monies have not hit account, but hopefully
money hit will be so. Any timelines?
Yeah, we gave April, so let me until April 31st.
The Health Ministry will soon begin the process of developing a universal health coverage roadmap, which will ensure timely access to quality health services by all Ghanaians irrespective of their ability to pay. Speaking during the commemoration of the 2019 World Health Day in Accra, Deputy Health Minister Alexander Aban said Ghana has identified primary health care as one of the key strategies in implementing the roadmap. Ifwa Evans-Chinri reports.
To achieve the goal of universal health coverage, Ghana has identified primary health care as one of the key strategies in implementing the roadmap for UHC in Ghana. According to Deputy Health Minister Alexander Aban, key strategies under consideration in operationalizing and implementing the Universal Health Coverage Roadmap includes increased national health insurance scheme enrollment and keeping members active and increasing financial resources. He says if universal health coverage is to become a reality, all players in the health sector must come together to build a national coalition.
To achieve the goal of the universal health coverage, Ghana has identified primary health care as one of the key strategies in implementing the roadmap for universal health care in Ghana. Primary health care is the pillar for building a resilient health system. It is no wonder that the theme for the World Health Day celebration emphasizes the critical role of primary health care. This strategy is a cost-effective and equitable way of delivering health service and helping countries to make progress towards achieving universal health coverage.
Mr. Aban mentioned that the UHC package of care includes key health services to be assessed by all people irrespective of age, gender and social status, as well as recognizing the different health needs of all people at different stages of life.
As part of our processes as a country, we have begun the process of developing a universal health coverage roadmap for Ghana. This will be part of our conversation at this year's Health Summit, which will be held on the 15th and 16th of April 2019. A definition for universal health coverage, which is currently under discussion, is, and I quote, all people in Ghana having timely access to quality health services, irrespective of ability to pay at the point of use, unquote. A package of health services that meet health needs and aspirations of the people in Ghana will be defined as the, and I quote, universal health coverage package of care.
The theme for this year's celebration is universal health coverage with a focus on the critical role of primary health care.
We're turning to our top story, which has to do with the flooding which occurred after Sunday night's rain. We're going over now to Ernest Menu, who's currently standing by at Bosokai with some of the affected people. Hello, Ernest, and what are the people telling you? I can imagine that it will be a difficult night for them. Right, Ernest appears not to have heard me, but Ernest, I'm asking, what can you tell us about where you are and the victims of Sunday night's rainfall? All right, so we will try and re-establish connection with Ernest for us to bring us an update on the situation there at Abosokai number 3, where some of the victims of Sunday night's rainfall and the flooding have been speaking or are sharing their plight with us. But we're watching JoyNews.
So we are here at Abosokai number 3. This is just the area close to the Great Lamte Mill School. The impact of the downpour has been devastating, so much so that in this area, a young lady, we understand, lost her life. I want to speak to this woman here who works with her directly. Auntie Medatisawa Wakayaho, Endra Esini, Insiono, Sana affect him.
Endrano. Me committee was on Johnson. Mente ha mumbai metimuha. Timidru had not said and so no framano yano. And I'm a stra bribe ha. My son is some Yapanichome and Yina Hokakonomia Kojinaho. And a bribe way or ha, coffee, our ha. And your Hana sister Bakuba Fresh say, coffee. Brana in Sona Kodam ho, no say Aquadan Bonia forces on Conon Kosher, to do happen or say Debbie, Nipanon Konya chain, with near Manuntino. On Jai, no, again, so for say, coffee no quadam ho. I know coffee is a debut or Saba so uncle. Now, in Yaman and say, no among Quanya day, and moho. And the guy no quite by 5 minutes, no by say, coffee mother woo. No, sad day, no, say, or for light, when no, when it's shock, station board, no, you know. Like na shock na manati.
Insione you dem ho.
Ina yiri content na kwa kwa dem kwa na mu yiri baby I had no be to me ko baby
Easy. Essentially what she's saying is that the place got flooded. Somehow that it entered the room, the bar where they work. This lady who has died entered the place and got closer to a switch and allegedly got electrocuted, and that's how come she lost her life. Let me speak to this gentleman as well who works directly with the lady. Kofi Chairman, Siono Sena is he affecting more area?
Isuone de nana ebum nyam ha nyina container ni mu nyina ye ma say din. Enti tema gen be frame me say me nkona amode ewu no. Nana me tu me na bonkum sim na anya me hwe me tu ni fa na tu azu say no. Na say ejane na mu den. Ena me pie say da bi me nso me di akira mewu. Nti de ye mpie nipa na nkwa hia. Nti mi nya de ye nwura mu nkoyi ganje se adum light no. Nana me shemu sa sun sa na ye peja again in the hospital.
So apparently, from what he tells me, because of the water, they had some cables falling off, and they had, the water was sort of full of electricity, so to speak. And so the lady got electrocuted, and he could have been electrocuted as well. Let me speak to another lady who will tell me the effect of the downpour. Madam, tell us, how did the water affect you here, the rain?
Please.
Look into the camera.
When the rain is falling, I'm not here. I went and buy bread. So unfortunately, on my way, when I'm coming, then I saw that the rain is falling. So I called my mother, but my mother didn't pick the phone. So unfortunately, when I reached here, then I said that, hey, there is a lot of water here, damp here. So unfortunately, this gentle guy, Alhaji, come and call me that, oh, something is doing this girl here, so I should come and help. I said, oh please, I'm going to store. I'm going to do 1 or 2 things. Okay. So unfortunately, they called me at Sukula that the girl have passed.
Okay, but what do you think is the problem here?
The problem is here is one thing, our dustbin.
Okay, come closer. Yeah.
Our dustbin.
What is it about that? Okay.
Our environment. Maybe one of 2 things. If somebody eats when buy papaya, take away and things, and then you drop down inside the gutter, and then you choke. Excuse to say that this lady will go and buy food. You make rubbish ramp. When the rain fall, then you go and drop inside the water to go to seaside.
So you think that littering and dumping refuse into the gutters is really the problem?
That's the thing. That is the whole issue.
And a lot of people here seem to agree with her that is really a part of the problem. And Easy, if you can hear, let me speak to some other people to get a view of what is happening here. This gentleman also tells me that he thinks that the water comes from upstream. What do you think about the situation here?
A big problem here. Kaje gone from Zongo Johnson. Keba baby got the tunnel here inside. Lole gbe den te tunnel yemi. She tunnel you on overflow or gutter denche. It was a big problem here from the top. Kajamata iko. Ke baton Zongo Johnson can baby nye bi efe onyo lolepo ya.
Mini
problem e ji gutter say underneath efe chi. Eja ke make a ball like toilet can be warm. It was situation me feel like I was denche san wonye what advice wohi agbene we ka banya fe committee ko na ba check na kan bi ani e ba prevent wo ni wo ya jowo e ja ke kan mo so fi opo e be bi e fe yi stores ni obi e containers no fe no overflow mo fe money be outside.
Hold on, so easy. He's also reiterating the point that it has to do with the sanitation situation here. A lot of them pouring refuse in the drains and choking it, and so that when it rains, the little rain, the whole place gets flooded, and they really have to suffer the effect of that. And he is saying that will be important for the people to be educated. He thinks that a committee will be set up to sort of look into this and deal with it. Committee I know about set up about feel like
to my task force school.
Okay.
Ni about hand respect ko aba kutu em ejake is very bad. Can you mo obana mo ko yen ball ani ka wumi ko awie ba nye jabo. Ne ba nye mobo e ba nye ejabo ni ta flat e ko le ko ana tuye oba fe ne hin.
And he makes a very important point. He thinks that a task force should be set up to ensure that the people here actually obey or actually comply with the rules, as it were, so that they do not dump refuse. He says specifically people deliberately put refuse into the drains, the storm drains that have been constructed here, and so the water is not able to, the drains are not able to hold the water, and it overflows. And so that's his opinion. That's how he thinks that the issue can be dealt with. And if you listen around, they all seem to agree with him. Most everybody here seems to agree that the problem is self-inflicted. But how are you coping? How are you coping? Remember, the area, I mean, to be coping.
Nyepeji mene babi e klen kejele bi efe mo ko ba ko bi e ma tujin ke ni bi me pi ani bi efite e o unbeliever ke sani ke government ba nye kwani ba wa me fiofio ko me na me ni bi efite agbene hu egbele bajemi ni wona ko na kan incident ye bi e da si bi ane wona e o solution ni wo ba nye wo find ko ni government e ke ba nye wa hu ni wa wo.
Okay, so they are saying that since the incident happened, there has been no government representative here, not more, nobody has been here. They think that government should be able to help them to fix the situation. As I say, Mustos no insio komo mo kopi sensena mo si dimba bravo.
Nya sa ban be ba boa ye say ni hwe ye sika o ye den yo ni nyina afrim. And I feel so good and so nipa obo ni din Jerry Justice Adom FM or say oh here guy
and dry no more than him we see them die.
Me dem me ko gina obi dem sa mentimana me gina dem o sa me mentimana fi say again dem ni close say that is from Nesoro intimate.
Let me speak to another lady who is here. And Johnny, you understand this here, no? More than die.
And intimate Accra. Some of my area and Yakura bra. You don't turn on with the ball and not good joining. Now, I got us in Taman to me saying, Intraman woman in a happy one. In Saturday, no more Munjai. And so I saw some boy, but never come a catacoi, and my never be at that.
And the whole day, son, I went to me a question.
David, but man got Macra. Yes, that's only before my yes, I bought this other level no more. Yes, sir. Can work Nabon and Kenya Bank, come here, but Ninka bedding.
So she tells me she was not able to go to work. She couldn't sleep yesterday because of the effect of the downpour, and as a result, life has become more difficult for a lot of them here. And so, the main chorus here is that they think that this issue of sanitation should be looked at critically, and some of them are even suggesting that a task force be set up to deal with this. Over to you, Easy.
All right. Thank you very much. That was Ernest Menu bringing us that update from Abosso Kai, and the people they're appealing to government to come to their aid. You're watching JoyNews Prime. All right, and that'll be all for JoyNews Prime for today. Up next, we bring you our hotline documentary, Born Too Soon, Part 2.